Yeah.
You know, it seems like in the sham group, if there's 7% of patients that have an 8-line vision improvement, clearly perhaps measuring just the ETDRS letters is not sufficient, and you showed microperimetry. Are there other ways that vision is going to be evaluated so that we can determine whether new treatments in this category, which has huge potential benefit, may actually be helpful?
No, I agree. It's a good observation. I think we've all seen every trial has sham patients that gain 3 lines of vision, and for no apparent reason except the fact that they learn how to take the test. I think we tried to eliminate that by using 8 letters rather than 4 or 5 letters, which I think it would have been even more noise going on than we had. I think using microperimetry is one way of looking at it. I think low luminance vision is another way of looking at it. And these things, you know, we're correlating it right now to see what's the best going forward, that we can actually prove that we're getting these good results.
So the majority of the effect seemed to be in the last few weeks of the trial. What does that suggest to you as far as when would be best to pick a primary endpoint for your next trials?
Well, that's a great question. I think we've learned that this drug may last a long time. If I was to make this trial, I would give the drug more frequently, to be honest, to make sure that I did meet my primary endpoint. Right now, there's no comparator. We would, you know, there's nothing that we can give except for vitamins, which everybody was receiving. So I think I would probably go 3 months rather than, you know, longer, and give it 4 times a year.
What's the half-life, David?
21 days, which will make it about 2 weeks, but I think it takes a while. I think this is really partly how long the effect lasts of the neuroenhancement or the lack of inflammation. I think it takes a while for it to come back.
David, in the neovascular AMD studies, we had blood or fluid that could resolve, that would result in improved visual acuity. Having 50% of intermediate AMD patients that are having 8 letters improvement is pretty stunning. What's going on? Why are these patients seeing better? What?
Well, I think that, you know, I'm not going to use the term neuroprotection because I don't know if that exists. But I think
even
that
neuroprotection is a preventative. It's not an improvement.
I think there's neuroenhancement here. I think that you have cells that are alive, but they're not functioning fully. And I think that that these cells are under stress, and reducing the stress allows these cells to function better, and that's what causes them to be able to see better.
Thank you. Thanks very much.